Greetings, fellow humans. Katrina here. Quick disclaimer: I'm a professional, not your professional. Nothing about say should be taken as medical, legal advice. This podcast is purely for education and amusement. That is it. Disclaimer over. So today I thought I'd talk about what I don't know about social support. And I want to be clear that I'm pulling this information from Psychology Today, an article written by one Courtney Beard, PhD, from Lab to Real World, and it was reviewed by Ikua Hagen. Don't know how to say that, but that's okay. And so the key points that I'll be going over today are threefold. Number one, strong social support is linked to better physical and mental health and a better response to trauma. Two, people who have experienced childhood trauma report poorer social support compared to people without trauma history. And thirdly, there are many ways to boost your own social support, and we'll cover six. So social support can be broken down into four types that science has identified so far. Number one is emotional support. And what that is providing information and advice that is aimed at helping somebody understand a stressful event and what resources or coping strategies are available to them. Second, instrumental support, providing tangible assistance such as service, money, or specific items. So I'm going to use examples. Informational support would be something like 988, which just came out in June of 2022. It is national in the entire United States of America. If you're having any suicidal ideations, calling 988, I think you can also text them, can be a helpful informational support resource. So instrumental support, like I said, is more tangible, and that would be something like loaning money or toilet paper or whatever the case may be. And then third is emotional support. And that would be providing warmth, reassurance, empathy, and care. A lot of times we can get that support from friends and family members. And then fourth is appraisal support, providing information to aid in self-evaluation of strength. And sometimes that can be through a clinical setting or another setting, but anything that aids in that self-evaluation of strengths. So this is pretty cool information. Studies have consistently found higher levels of perceived social support. Be clear that that says perceived, not actual. So higher levels of perceived social support to be associated with reduced psychological distress after experiencing a traumatic event. For example, Prosher and colleagues in 2020 examined perceived social support in combat veterans and found that veterans who perceived those higher levels of social support were more likely to report lower levels of PTSD symptoms, depression, anxiety, mental health related disability, and a greater quality of life. So although social support has been found to protect against the negative effects of trauma, previous research has also shown that some people who experience childhood trauma grow up to have less social support later in life. And that's by Sperry and Wyndham back in like 2013. And people have recently tested whether this finding would hold up within their own psychiatric sample at behavioral health partial program at McLean Hospital. So what they did is they surveyed 234 patients, most of whom were seeking depression, anxiety, bipolar disorder, and borderline personality disorder. And what they found, let me tell you, they found a history of childhood trauma predicted lower levels of perceived social support. And secondly, this relationship remains significant after controlling for race, age, sexual identity, gender, and depression severity. So, how might experiencing trauma interfere with a person creating and maintaining a social support network? One potential explanation is related to trauma's effect on emotional regulation. Prior studies have found that both positive and negative emotional dysregulation were associated with negative mental health outcomes in trauma-exposed individuals, and that was from Weiss back in 2020. This is suggesting the importance of further studying the influence of maladaptive emotion regulation strategies on mental health outcomes following trauma. An example of a maladaption emotional regulation technique would be self-harm. There are emotional regulation strategies that are much healthier out there. Another potential explanation for lower levels of social support following childhood trauma comes from what has come to be called the deterioration model of social support. So researchers have theorized that due to the nature of certain childhood traumas, for example, abuse, As private and socially stigmatizing stressors, many survivors may feel isolated as though there is no social support available to them. And that was discovered in 1993 by Kniasti and Norris. Indeed, a recent review of stigmatization among female survivors of childhood sexual abuse observed that self-blame, shame, and anticipatory stigma acted as barriers to disclosure and help seeking. And that was from Kitty and Proc 2016. So I mentioned at the beginning that I would talk about ways to boost your own social support. So here are 6 ways to boost social support. Because given that many people are dealing with the effects of trauma in one form or another, these can be beneficial to a lot of folks. So number 1 is get a furry or furless friend. Social support isn't limited to human interaction. Studies have shown that our pets can offer us the same benefits that a human social support does. And that was found in a study done by Allen et al. In 2002. So you can check your local news for adoption events near you, stop by a shelter, or use online resources to find the newest addition to your family. And as an added benefit, this will give you a great topic of conversation to bring to the remainder of this list. Number 2, pursue that hobby that you've spent quarantine thinking about. This article was written in June of 2021. It says, get involved with new clubs or classes. Check out your local community centers, schools, gyms, or recreation department websites to see if there are events being offered. Honing your skills and developing new passions with a group of people interested in the same thing is a great way to start building your social network of like-minded individuals. I know here in Tulsa, there's a place where you can paint with a group of people ceramics. You can go and they already have the little figurines there white for you, and you can just paint them till your heart's content. Number 3, join a volunteer or religious organization if that's your jam. The pandemic has impacted more than just our way of life, resulted in widespread job loss, food insecurity, homelessness, and mental health challenges. Now, more than ever, there are numerous organizations looking for volunteers, whether it's the soup kitchen or crisis hotline. And beyond making a difference in your community, volunteering is a great way to connect with people who hold similar values. Many people find a meaningful sense of connection from their religious community. And if you don't have a religious or spiritual community, you can seek out what interests you. If you are already a member of a group, think about how you might get more involved. If you see other people volunteering, maybe raise your hand too and say, hey, I can help. Number 4, get outside and enjoy your community. Whether you live in a big city or small town, a great way to get to know your neighbors is to take a walk through your neighborhood. Related to the first thing I mentioned, step 1, you may be able to meet people in town just by taking your dog for morning walks, learning your barista's name, stop and greet your neighbors as they leave for work, or simply take note of upcoming community meetings or tag sales you could attend. 5, reach out to family, friends, and coworkers. We've all been guilty of not responding to a text or saying, I'll just call them back tomorrow. For many of us, the past couple years has been so draining that it has been tough to find the motivation to do the simplest things, and staying connected to our loved ones is included. Reconnecting with your existing friends and family is a relatively low-hanging fruit to enhance your social support. 6, join a support group / look for a peer support group. If you've been struggling during the last few years, you're certainly not alone. Support groups are a great way to find support for specific stressors, such as the death of a family member, coping with chronic illness, or managing your mental health. I know here in town we have, as far as death goes, a grieving center called the Trustees Grief Center in Tulsa. They're really, really helpful to a large population of the community. And then coping with chronic illness, we have places in town that help out with that kind of thing, and support groups that are available for people who do have some sort of chronic illness, even if it's not a mental health condition. Sometimes things like arthritis, diabetes, chronic illnesses can affect our mental health, and then managing our mental health. There's different peer support groups out there for borderline personality disorder, for example. There are groups that people can join to, I think here in town we have a Tulsa DBT that offers a skills support group or a skills class. I'm not sure which one. But anyway, these types of groups offer a unique opportunity to practice lending support to others. And research shows that providing instrumental support to those around you may be actually more beneficial than receiving support. And I'll go ahead and give you a reminder of what the instrumental support was. That's where it's a tangible thing. So whether it's your time, your money, or your goods, that can be really beneficial to your own mental health. And that was found by Brown et al. In 2003. So like I said, this was an article that I read from. A lot of the information comes from Courtney Beard, PhD, and she referenced a few other folks. And I hope you enjoyed today's information. And if you want to support the show, you can click the button on the website. And remember, I appreciate each and every one of you simply for existing.